Hello, you're welcome to my platform. I am Dr.Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about tuberculosis. Tuberculosis is a condition that commonly affects the lungs, and it is usually as a result of infection by a bacterium called Mycobacterium tuberculosis. Although the Mycobacterium tuberculosis, the bacterium that causes tuberculosis, commonly affects the lungs, it can also spread to other parts of the body. For example, the liver, the kidneys, the adrenal glands, the peritoneum, that is the sheath that lines the intestines, as well as the inner walls of the abdominal wall. It can also spread to the spine, especially the lumbar spine. It can also spread to the brain and the meninges. The meninges are the coverings of the brain and the spinal cord. The Mycobacterium tuberculosis, that is the bacterium that causes tuberculosis, that is TB, can be transmitted from one individual to another via inhalation, that is breathing in of the bacterium. Normally, the individual that is spreading the Mycobacterium tuberculosis, the bacterium that causes TB, usually has what we call active TB. That is, they have signs and symptoms of TB. And when they cough, or when they laugh, when they sing, when they talk, they can release this bacterium into the air, and another individual that is not infected or any other individual in the vicinity can breathe in that air, and that is how they get infected. However, not every individual that breathes in or gets infected with the Mycobacterium tuberculosis actually ends up with active TB or ends up with the signs and symptoms of TB. This is because the immune system, the system within our body that is responsible for protecting us from invading germs, for example, bacteria, for example, the Mycobacterium tuberculosis, has a way of walling off the Mycobacterium tuberculosis such that it does not spread to the rest of the lung or to the opposite lung or to the rest of the body. However, if an individual has a poor immunity for some reason, maybe they have HIV, they have diabetes mellitus, they have cancers, or they are advanced in age, or they are very young and their immune system is not well developed, they don't have the luxury of their immune system protecting them from the Mycobacterium tuberculosis. So when the bacteria enters into the lungs, it can easily spread to the rest of the body, and they can have signs and symptoms of TB, active TB. Normally, when a bacterium, for example, Mycobacterium tuberculosis or any other bacterium is breathed into the lungs, it is supposed to be eliminated by the cells of the immune system called the macrophages. Now what happens is the macrophage is recruited into that area of the lung, and they engulf, they swallow the bacterium, and they enclose it into a small bag called a phagosome. Now the next step is there has to be a union between this small bag where the bacterium has been enclosed and another structure of the macrophage called a lysosome. The lysosome has enzymes that are supposed to kill this bacterium. However, what happens with the Mycobacterium tuberculosis, it produces some chemicals that sabotage the union between the sac where it has been enclosed, the phagosome, and the lysosome, the structure that has the enzymes that are supposed to eliminate it, to kill it. So this means that the enzymes within the lysosomes don't get the chance of killing the Mycobacterium tuberculosis. So it continues to multiply in large numbers inside of the macrophage, the same cell that was meant to kill it. Once the macrophage fails to eliminate the Mycobacterium tuberculosis that it swallowed, it produces some chemicals called cytokines. These cytokines help to signal other macrophages. It helps to recruit other macrophages into the area of the lung that was affected. Some of these macrophages that have been recruited tend to surround the macrophage that engulfed, that swallowed the Mycobacterium tuberculosis, and this helps to form a wall around it. Other macrophages transform into other cells. For example, some of them elongate and they can form new cells called epithelioid cells. The epithelioid cells further contribute to the wall that is formed around the macrophage that initially swallowed the Mycobacterium tuberculosis. Other macrophages join together and they form bigger cells called the Langerhans giant cells, and these further contribute to the wall that is formed around the macrophage that initially swallowed the Mycobacterium tuberculosis. Other cells of the immune system, for example the dendritic cells, eosinophils, and the lymphocytes, are also recruited into this area, and these further contribute to the wall that is formed around the macrophage that initially swallowed the Mycobacterium tuberculosis. There is also a recruitment of other cells called the fibroblasts. The fibroblasts lay down a given tissue called collagen, and this also contributes to the wall formed around the macrophage that initially swallowed the Mycobacterium tuberculosis. So the end product of this is formation of a granuloma. A granuloma is essentially a cluster of these cells that surrounded the macrophage that initially swallowed the Mycobacterium tuberculosis, preventing it from spreading to the rest of the lung and to the rest of the body. During the early stages of the formation of this granuloma, there's a lot of blood supply to that area of the lung. However, as time goes on, there is a reduction in the blood supply to that area. The blood supply is even worse in the center of this granuloma. So the tissues within the center of the granuloma tend to die off and they turn into a substance which looks like cheese. And we call this process caseous necrosis. This area of the lung where caseous necrosis occurred is called a gone focus. Sometimes the macrophage that engulfed, that swallowed the Mycobacterium tuberculosis, can transport it to the hilum of the lung. By the way, the hilum of the lung is that area of the lung where the branches of the trachea, the windpipe, enter into the lung. And this macrophage that now contains the Mycobacterium tuberculosis can go to the lymph nodes of the hilum, the hilar lymph nodes, and the entire process that I laid out earlier occurs. That is, this macrophage is surrounded by other macrophages. Some other macrophages elongate and turn into epithelioid cells. Some unite and form the Langerhans giant cells. Other cells of the immune system are recruited into the lymph node, for example, the dendritic cells, the lymphocytes, the eosinophils, and the fibroblasts also come into play, and they lay down collagen, forming a wall around the Mycobacterium tuberculosis infected macrophage. But this time around, it's in the lymph node. But as time goes on, still in the lymph node, the center of this cluster of cells will die, and there will be formation of some tissue that looks like cheese, a process called caseous necrosis. Once caseous necrosis occurs in the lymph nodes, we call this area a gone complex. Sometimes the fibroblasts can lay down collagen in that area of the gone complex, and also calcium can be deposited in that area, and so the area can undergo fibrosis and calcification. And once that happens, the area is called a Ranke complex. Everything that I have explained so far comes down to the fact that the Mycobacterium tuberculosis is still alive in the lungs, but it is being contained by the cells of the immune system. The cells of the immune system are forming a wall around it such that it does not spread to the rest of the body. At this point, it is still dormant. The patient has what we call latent TB. The patient doesn't have the signs and symptoms of tuberculosis TB. However, in the context of a low immunity, for example, HIV, diabetes mellitus, malnutrition, the very young, the very old, the Mycobacterium tuberculosis cannot easily be contained by the cells of the immune system, so it can spread to the rest of the lung and the opposite lung. The Mycobacterium tuberculosis can affect different areas of the lung, and this can result into death of those areas and subsequent formation of cavitations. Because the Mycobacterium tuberculosis cannot be contained by the cells of the immune system in the setting of a low immunity, it can now be transported into blood, and the blood can take it to other tissues and organs of the body. For example, the kidneys, the liver, the adrenal glands, the peritoneum, the spine, the brain, the meninges, that is the coverings of the brain, and the spinal cord. Therefore, TB can be classified into pulmonary TB, where it is only affecting the lungs, or it can be classified into extrapulmonary TB, that is if it is affecting other parts of the body. For example, the kidneys, the liver, the adrenal glands, the peritoneum, the brain, the spine and the meninges, the coverings of the brain and the spinal cord. It can also be classified as active or latent. Active TB is when the patient has signs and symptoms of TB, while latent TB is when the patient does not have signs and symptoms of TB, but they have been infected by the Mycobacterium tuberculosis. Majority of the time, these patients that have latent TB have a good immunity. The cells of the immune system are trying to contain the infection from spreading. The individuals that are commonly affected by tuberculosis include individuals that live in crowded environments, for example, prisons, slums, individuals that have a low immunity for some reason. Maybe they have HIV, they are very old, they're very young, individuals that have diabetes mellitus, individuals that have malnutrition, those on steroids or anti-rejection drugs, maybe they have undergone an organ transplantation, individuals that live in areas that are known to have a high prevalence of TB, for example, Africa, Latin America, Asia and Eastern Europe, individuals that have been in contact, physical contact, or that have been in the vicinity of an individual that has active TB, or an individual that has been diagnosed or suspected to have TB, as well as the intravenous drug abusers. The signs and symptoms of tuberculosis include a low-grade fever, and this fever tends to increase in the evening. That is, the body temperature of the affected individual tends to become higher during the evening time. Loss of appetite, weight loss, cough lasting for more than 2 weeks, hemoptysis, that is coughing up of blood, chest pain, general body weakness, chills and night sweats. When the Mycobacterium tuberculosis spreads to other parts of the body, the affected individuals can get complications. For example, if it goes to the liver, they can get what we call hepatitis. When it goes to the coverings of the brain and the spinal cord, it can result into meningitis, that is inflammation, irritation of the coverings of the brain and the spinal cord. When it goes to the spine, it can cause a condition called Pott's disease, that is TB of the spine. When it goes to the adrenal glands, it can result into Addison's disease, and it can also cause enlargement of the lymph nodes, for example, the lymph nodes of the neck. The investigations that we carry out in tuberculosis include a complete blood count, ESR. We can also do screening tests, for example, the tuberculin test and the interferon gamma release assay. We can also do a chest x-ray, looking out for enlargement of the hilar lymph nodes and cavitations. We can also do a sputum analysis, where we take off a sample of the sputum from the patient and we can do gram staining, Zell-Nelson test and a PCR. A bronchoalveolar lavage analysis can be done in individuals that cannot provide a sputum sample, for example, the very young. Still, we do a ZN, PCR and a gram staining. When it comes to the treatment of tuberculosis, we employ anti-TB drugs, and majority of the time we start with the first line drugs, that is the rifampicin, isoniazid, pyrazinamide and ethambutol. The individuals usually start with the 4 drugs for 2 months, and after that they can continue with the rifampicin and isoniazid for the next 4 months, such that they take the medications for a total of 6 months. If you or your loved ones has been diagnosed with tuberculosis, please make sure that you take these drugs as prescribed by your doctor, because if you don't take your drugs the way you should, the tuberculosis can now transform into a more serious form, that is the multi-drug resistant tuberculosis. When you get the multi-drug resistant tuberculosis, it means that you are no longer responding to the drugs that we normally use for tuberculosis, especially the rifampicin and isoniazid. During the treatment for the multi-drug resistant tuberculosis, we use the second line drugs, for example, amikacin, kanamycin, or capreomycin. These patients are usually treated for a longer period, that is at least 9 months. In unfortunate cases where the affected individuals don't adhere to the second line medications for tuberculosis, the TB can now transform into a worse form, that is the extensively drug-resistant tuberculosis. The extensively drug-resistant tuberculosis is usually treated with a combination of drugs, at least 3 drugs. That is a combination of linezolid plus bedaquiline plus pritomanid. Another option is bedaquiline plus linezolid plus moxifloxacin. When it comes to the prevention of tuberculosis, the following can help. Please cover your mouth when you're coughing. Please also exercise good hand hygiene by regular washing of your hands with soap and water. Please also avoid close contact with other people, especially individuals that have signs and symptoms of TB that I laid out earlier. If you have other conditions that can predispose you to tuberculosis, for example, malnutrition, diabetes mellitus, HIV, let this be treated. Proper ventilation of the houses, schools, prisons, churches, hospitals, or other areas where there is overcrowding can help prevent tuberculosis. And if you have been diagnosed with tuberculosis, please take your medications as prescribed by your doctors, licensed medical doctors. And before you can integrate into the community, for example, to your workplace, to school, please make sure that your doctor recommends you do so. Let him or her recommend that you're no longer contagious or you can no longer transmit the infection to other individuals. And for the healthcare professionals and the attendants or the close family members of the affected individuals, please make sure that whenever you're in company of the individual that has been infected with the Mycobacterium tuberculosis, especially when they have signs and symptoms, please wear N95 masks. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.